Without my belaboring the point and going on for too long, we'll get to our speakers. Our first is someone we're truly excited to have here. It's Dr. Giroux, and she has come our way from Colorado, where she is a co-founder of the Movement and Neuroperformance Center. She has a holistic approach to care that stems from her interest in the mind-body connection. So I think this is really going to be a very, very interesting conversation, and her belief in the capacity within each of us to do some self-healing. She's currently working on an innovative approach to deep brain stimulation therapy. She's authored a number of books. She's nationally recognized for her work as a movement disorders specialist. She was educated at Ohio State University, Emory University, the University of Arizona. And if she doesn't talk about this today, this is something that I want to pin her in a corner and talk about. Her hike to the summit of Mount Kilimanjaro, which under any circumstances I think is an incredible achievement. But the fact that she was with, if I'm not mistaken, 14 companions, many who had Parkinson's, who she assisted getting to the summit of Kilimanjaro. Hopefully the snows were still there.
Yes, they're still. Can you hear me okay? Testing. Oh, okay. Here we go. Well, let me correct that.
Okay.
The people with Parkinson's and MS assisted me up the summit.
And with that, I'll turn it over.
Okay, good morning. Thank you, Chris, and thank you, Pat, for inviting me to present to you all and the Western New York National Parkinson's Foundation. I'm going to start this morning off by talking to you about integrating healing therapies and integrative medicine into your treatment plan. It won't be a list of treatments and therapies. It really will be a philosophy of care, which is important to doing your best, feeling your best, and perhaps changing the trajectory that is Parkinson's for you. You are in control. And a lot of the information that I present today is included in two books that I wrote. One is called Alter Your Course. I wrote with my colleague Sierra Ferris, which was really about, well, the reason we wrote this book was we had a lot of people recently diagnosed, and a lot of the information out there was about symptoms and treatment, and everything was a little overwhelming. So it more is really a book that reviews what you can do best, how you wrap your arms around, your head around this new diagnosis of Parkinson's to do better and feel better. And then my most recent book, which I'm very proud of, is Optimal Health with Parkinson's Disease. And I even forget the title, A Guide to Integrating Lifestyle, Alternative, and Conventional Medicine, because I think it's so very important to take a holistic approach, and that's what we'll talk about today. When we talk about integrative medicine, it really is the best of both worlds, right? It's the best of traditional, or what we call conventional medicine, medication and surgeries, and perhaps alternative and personal healing. But when we think through this, we don't assume that all traditional medicine is bad and all alternative and healing medicine is good. It's really a balance, and we need to approach it as such. It's personalized care. And what's important to one person is very different than what's going to be important to the next person and the next person. It's really one that centers around an individual's, not only what they need, but their beliefs and their values, and it's focused on action and the experience. So I'm a neurologist, but I like to talk about taking care of people with Parkinson's disease, not as treating Parkinson's, but really the Parkinson's experience, and that's what we're trying to modify, you and I. So let's look at this. Having a little trouble with the advancer. Okay. So my presentation today wants to answer or follow these two questions. Does Parkinson's disease present an opportunity in disguise? And I learned this from you. And what information, actions, or attitudes will set the stage for living your best now and into the future? So when I go through various topics, I want to discuss them with that in mind. Do we have an opportunity to look at things differently And I challenge not just people living with Parkinson's, their caregivers, their families, but also healthcare providers, maybe to look at things a little bit differently as we treat the Parkinson's experience. Let's start off with diagnosis. We never really talk about the diagnosis other than being given a diagnosis. But I think this is a place to start, because how you navigate your life with Parkinson's disease at diagnosis, or when there's a change, if things progress, if there's a bump in the road, really depends on where you are with your, what I like to call, stage of understanding your condition. And it's very akin to the stages of grief that we all are aware of. And I'm just going to go through these and won't have a lot of time to talk about each and every one, but the person with Parkinson's disease might be in a particular stage, perhaps just given the diagnosis and it's denial, and I don't have it, and I don't have any problems, and I don't need to do anything about it. Or maybe it's anger. Why did this happen to me? I didn't deserve this. I didn't do anything. Or fear. What about my future? What's going to happen going into the future? Perhaps depression, acceptance. Where you are, and might I say where your caregiver is or care partner is also very important. And talk about it. Think about where you are, because where you are in any of these stages, and I agree they're somewhat superficial, but they help. Where you are in these stages helps you understand how you will receive and how you will go after treatments and therapies. Or maybe you and your care partner might be in different stages. It's not uncommon that we see perhaps the person with Parkinson's still in a little bit of stage of denial, and the care partner in a very different, and we have to tack this, and we have to aggressively go after this, and there's a little butting of heads. Having that discussion helps you move perhaps from one stage to the next. It really is fluid. It's not linear. You're not going to move from denial to anger to fear, and you can drop back and forth. You might be in acceptance today, and tomorrow you're in anger. But understanding that is the first step to tailoring your therapy and getting the most out of your treatment, as you can understand how these stages influence how you might receive care. Well, I won't talk a lot about the symptoms of Parkinson's disease, but I do want to talk about a question that myself and a lot of the people here in the panel are asked. So what's in store for me? How am I going to progress? What stage am I in? And there is a stage that quantifies your place in Parkinson's. It's mostly a research tool. One of the problems with this stage is it's not necessarily a linear stage. If you're in stage 2, that doesn't mean you're performing twice as bad as stage 1, and stage 1 is half as bad as stage 2, and so on. There was a research study looking at how people progress from stage 1, Parkinson's on one side of the body, stage 2, Parkinson's on both sides of the body, stage 3, starting to experience balance problems, etc. Now, you might say, are these numbers mine? Well, the answer is this research is old, and this is not what is going to happen to you. Why? Because if we know how Parkinson's may change, it may not be how it changes for you, but you know how it may change. Put that program in place to prevent, delay, and minimize those changes. Do it now. And if you're having those symptoms, all the more reason to attack it. Just going through. Some of the symptoms or changes when we look at that staging of Parkinson's disease. We know gait, balance, postural instability is a problem. What are you doing today for your balance therapy? Today, every day. Posture. I don't know about you, but I even go by the mirror and look at my posture and think, boy, there's work to be done. You don't have to have Parkinson's disease for this to apply. Speech. These are some of the problems that over time can really contribute to life quality, and even some non-motor symptoms, perhaps like depression. Treating depression, being aware of depression, mood problems, so very important, because if you have depression, what are you doing? You're seeing life through different colored lenses, darker lenses, and it influences all your choices, activities, and attitudes. So even if we look at medicines, we want to look at both sides of the coin, so to speak. And I'm not going to talk about all the medicines used for Parkinson's disease. And this is a little cartoon that is used to show various classes of medicines that enhance dopamine, because Parkinson's disease is associated with neurodegeneration, loss of these dopamine nerve cells, decline in the neurotransmitter dopamine. And the good news is we have medications that can attack this problem through multiple angles, and we use medicines across the continuum, and that arrow represents time and disease progression. And you'll see I listed some classes of medicines or treatment underneath, and there's quite a few. Now that's the good news. There's many different choices, but those choices will be different for each and every person. Now in Colorado, where exercise, as everywhere, exercise is becoming a big part of the treatment. Sometimes I hear from people, I don't need medicines, I'm just going to exercise. That's going to take care of my Parkinson's disease. Often it's a balance. Medicine is still needed, and we're learning perhaps medicine is needed early with Parkinson's disease. We want to optimize movement symptoms as much as we can, understanding that these medicines also have their share of side effects, so it's a balance. You will do better going forth by doing better today, right? And we'll talk a little bit about neuroplasticity and what that means later in this discussion. So there's a tendency for people who are interested in integrative therapies and alternative therapies to be a little hesitant to accept prescription medicines into their treatment plan, but they are best when used together to optimize care, symptoms, and outcomes. Now, let me just talk a few things about using medicines or understanding medicines. The goal is optimal motor control. That doesn't mean all symptoms will necessarily go away or tremor will be reduced to zero. We are limited by medications and medication side effects. Often that is why we use more than one medicine together to try to reduce individual side effects of certain drug classes. But as you use multiple medicines together, the last one in is not the first one to leave if you have a side effect, because it's the combination of all the medicines together that might contribute to that side effect. And so what your doctor will do is look at your list of medicines and modify the one that maybe has the greatest risk of causing that side effect. Just like all integrative therapies, it's looking at the big picture to understand what's giving you the best impact or maybe causing any additional problems or side effects. One thing that I always tell people is be practical about your medical care, and sometimes that also means understand some practical questions. If you're given a new medicine, you might just ask your doctor, for me, what are the top 3 or 4 side effects that you are worried about for me? Because if you read that list of side effects, and it's 100 side effects long, what will you get? Oh, you'll get worry, you'll get stress. And what will that do? That will impact how that medicine works for you. A little bit of what we call the placebo or nocebo effect. Again, I'm going to address that later in the discussion. And there's some new medicines, and I know you'll hear about these new medicines, but the great thing about these medicines just came out in the past year or so, and they are addressing a difficult problem as far as motor symptoms with Parkinson's, that is the on-off fluctuations and dyskinesias, and it's wonderful to have new options in that situation. And we have medicines now targeting non-motor symptoms, which is really very important, because up to this point, we haven't really had a lot of targeted medicines to treat some of the non-motor symptoms. And the non-motor symptoms can be quite significant, whether we're talking depression, anxiety, cognitive issues, bowel or bladder issues. Orthostatic hypotension, by the way, is a drop in blood pressure when you move from sit to stand or lying sit to stand. And that drop of blood pressure might be shown as dizziness or weakness or fatigue. So it's exciting to have these new medications to look at. Believe it or not, as an integrative medicine specialist, I often get people that come to me with that because of that background, and we also have a background in deep brain stimulation. And many people say, I want to skip those medicines. Let's talk about surgery. So that's an interesting comment because it reflects how our values impact our care. And I'm not making a value statement one way or the other, but we all come to the table with certain values about which treatments are right and which treatments are wrong. And for instance, in this situation, many people are hesitant to take a pharmaceutical medication but want to go right to head to the neurosurgeon who may drill holes in their head and implant the deep brain stimulation wires, which are a greater risk. So again, I kind of pose to you, think about what you're bringing to the table as far as your values. And by the way, Chris, I thought when you were going to corner me, I thought you were going to corner me about medical marijuana, not the top of Mount Kilimanjaro, because I come from Colorado, and not only do we have medical marijuana, it's now legalized on the street, so it's a very unique situation. And before I moved to Colorado, I lived in Seattle, and they have the same thing now, so it must be following me. I don't know if you want me to move to Buffalo or not. But you know, when is the right time for deep brain stimulation? Early on with Parkinson's disease, medicines work, and they're working well, hopefully, managing your symptoms. Over time, the effective medicine might wear off, still working, but maybe it's wearing off. You have those on-off fluctuations, or as an attempt to improve your motor symptoms, your clinician is adding more medicines, might precipitate dyskinesia, what we call uncontrolled involuntary movements. As the disease progresses, reflects more global generation of nerve cells outside of the dopamine area of the brain, there are some symptoms, like I mentioned earlier, that tend not to respond as well to medications. Balance issues, freezing of gait, speech and swallowing. Well, this is a really important thing to understand when we understand the timing of deep brain stimulation. It really is a treatment for tremor and a treatment for those motor complications, the fluctuations and the dyskinesias. Now, there is a move towards deep brain stimulation earlier in disease course. I'm going to need it anyway. Why don't I just get it? If medicines are working for you now, and the deep brain stimulation is only going to treat the same symptoms as medicine, you may not want to take the risk early on. And the risk is not just surgery. People think about the risk being surgery. The risk is lifetime management of the deep brain stimulation, the programming, the medication monitoring, the reality of the hardware in your system. So it's really how the team comes together to manage your care and the outcome. So again, this is where a balanced approach is most important. But we also don't want to wait too long. Deep brain stimulation is not a treatment that does best when it's a treatment of last resort, when the non-dopamine responsive symptoms come into play. So like everything else, it's a balance. How we use medicines is a balance. Where deep brain stimulation fits in your regimen is a balance as well. And since deep brain stimulation does as well as medicines, there are some symptoms it may not tackle, like walking, balance, freezing of gait. We have our friends in rehabilitation therapies. When we think about rehabilitation, we think about physical therapy, occupational therapy, speech therapy. We have to think about, why are we using it? What's the goals? And I learned this early on because I'm a proponent for rehab, and I would send my patients early at diagnosis, see the physical therapist. I remember one person I sent to physical therapy. He went once or twice, and he came back, and I said, how did it go? He said, waste of time, I'm not going. I quit, I'm not going, waste of time. What do you mean it was a waste of time? Well, they didn't fix me. Well, I didn't do my job either in that situation, did I? So the goal was not just to fix you, but sometimes we go into treatments with that idea in mind, it's going to fix me, or someone else is going to do that to me. Well, one, it's a partnership, right? It's teamwork. You're going to do that. You're going to work on yourself with them as a coach. But maybe it's not the 100% fix. Maybe it's one of many things. Yes, we want to reduce or improve your symptoms. We want to establish a safe and targeted exercise program that's really molded to your strengths, weaknesses, and where you want to go or be. Maybe delay or prevent the future symptoms, like I mentioned before, the balance issues, the gait issues. But also, we don't really talk about establishing optimal lifetime strategies, habits, and goals. How many of us are just good at everything? Where's the hands? We're not. We need that coaching. And how many of us just have the most perfect lifestyle habits? We don't. We need that, and I would argue that so important our rehabilitation specialists are to help us optimize our life living strategies with Parkinson's disease and be there along the way every once in a while for that little kick in the butt to keep it going. So sometimes you have to advocate for your own care. Don't expect your doctor always to write the prescription for you, or this day and age, send it off electronically, right? Because they may not remember that it's been 3 years since your last physical therapy visit, and we really need to readdress these things and move it along. But you remember, so to me, it's your job to bring it to the table. Hey, I'm just noticing my balance isn't as good as it used to be, or I'm really dropping off on that therapeutic exercise program that I know is so important to me. What do you think? Can we re-engage physical therapy? Also, physical therapy is medically trained to assess you, evaluate, and put forward a therapeutic program. Now, that doesn't mean the personal trainer doesn't have an important role in your care, but use them perhaps together to, what I like to say is, not necessarily work harder. Maybe you need to work harder, but work smarter, right? Exercise smarter, just don't exercise harder. You might need to do both. Now, what else can rehabilitation offer? Well, it's an opportunity for socialization, engagement. Feeling the possibility and sense of control is so very important, and these folks give you the tools to help enhance that. But it also can be a very valuable therapy for many of the non-motor. We think a lot about the physical. We think a lot about the motor when it comes to Parkinson's disease. Why? Because we can see it, because it's obvious. The tremor, the stiffness, the rigidity, the walking issues. We can see it, it's obvious. But we forget about some of the other non-motor symptoms that really can impact quality of life as much, for some individuals more than the motor. So rehabilitation can help with sleep issues, can help with fatigue, depression, anxiety, pain, bladder, communication, dizziness, leg swelling, apathy, the list goes on. So think about what rehab can do for you. And I blog a lot, and there's a link to my blog there. And by the way, I've put a practical tips sheet on my blog this week for you all, which summarizes some of the things I'm talking about here today. But I have a rehabilitative worksheet, which is really just a list of questions and experiences you might have. And as you go through that worksheet and answer the questions yay or nay, you get an idea of who might be a helpful specialist for you. So you can take advantage of that if you wish. Now, rehabilitation timing is everything. When's the right time? When you have a problem? Yes. But through all stages. Especially when you're recently diagnosed, not just when you're having problems, because you want to set the stage. You want to work smarter, not just harder, as you go through your years with Parkinson's, correct? So throughout the continuum. Now let's talk about neuroplasticity, and that's a lot of what I'm talking about today. As you sit here, you're all experiencing neuroplasticity. I hope it's positive. Neuroplasticity is how your brain changes, brain activity, brain function changes based on your actions and your experiences. And neuroplasticity, like I said, can go in either direction, positive, negative, or it can be neutral. The brain is really smart. It continues to modify itself to enhance life quality, or the opposite can happen. And I'm not going to go through each and every one of these pictures on the slide, but I'm just going to tell you what they represent. One particular slide in the upper left-hand corner looks at brain volume changes in response to exercise. Now, this is older adults, not necessarily people with Parkinson's, but it tells us two things. There are different areas of the brain that react to high-intensity versus low-intensity exercise. And I put this up there because sometimes there's the idea that the only way to exercise with Parkinson's is high intensity. And remember the concept I said of balance. We need to do it all. There is another picture in the middle at the bottom with crosshairs over an area of the brain that is involved in our memory, called the hippocampus. There's increased hippocampal volume and increased memory abilities or improved memory abilities due to exercise. So exercise helps cognition. So that's the other important thing to know, that it's not just we have to look at a balanced exercise approach. Exercise helps more than just motor control. We know that. We know we feel good, for instance, when we exercise. Up in the upper right-hand corner is a very interesting research study that looked at people who had injuries to their arm, and their arm needed to be casted. And this is a special imaging technique which looks at nerve fibers in the motor territory, and they did this imaging before they casted, and a couple weeks later, in just a couple weeks, they were able to measure through imaging changes in that nerve activity. But guess what? We also note that there are changes in motor activity after even just 5 minutes of practice. So it goes in both directions. There's something to use it or lose it. Every 5-minute counts. Now, when we talk about neuroplasticity, how do we get the most out of this whole concept of neuroplasticity? It's more than just exercise. But we're talking about our experiences today. If you're having a positive experience through learning, through socialization, through the acquisition and the support, and through the concept of hope, that's neuroplastic experience for you in the positive direction. So learning, repetition, practice, complexity, value, integration, and quality. So if you think through some of these, they're quite obvious, right? An Olympic athlete didn't become an Olympic athlete by not practicing, by not repeating over and over again. Remember I said work smarter, not just harder. Sometimes we tend to repeat over and over again things that aren't just maybe done quite with the best quality. So I see sometimes it's all about how much you do, how the numbers, the time, the intensity, but the quality of the effort or the performance is poor. And I'm going to share a research study with you that supports that. Value and integration. How do we integrate our senses, our emotions, our feelings, our mind, our body in our therapies is a really very important thing, and that's one of the crux of mind-body medicine, using the mind as well as the body. And when we talk about this, I use Tai Chi as an example, and I also have, well, actually Tango is my example, but I also put tandem cycle Tai Chi. Every year it seems like there's a new exercise paradigm that's recommended for Parkinson's. It happens to be one that just is probably the more recent one studied, but almost any exercise is going to help some aspect of Parkinson's disease. But just think of Tango. When research supports Tango for improved balance, it's not really just about the movement, is it? Well, it's physical, it's aerobic, where it's musical, we're engaging the beat, it's very creative, it's very social, you might even say it's kind of sexy, right? It is hopefully relaxing at times, it's engaging, you're learning new things because most of us aren't professional tango dancers. It's relational, it's touch, the emotional impact, all of this, I believe, it's very difficult to study, but I believe is why Tango was so beneficial and at least one measure balanced, but all these other things weren't measured. And that's why just going to the gym and doing this is good, but maybe that's not the only way to strengthen this bicep, right? So how do you incorporate these things into your therapy? I have some people that exercise and they've got their treadmill it's in the basement and it's damp and it's dark and they hate it. Maybe, and I use the term maybe, they're not getting as much out of that experience, that neuroplasticity, as maybe the treadmill in a more pleasant area, or working out as a group, or so on or so forth. There was an actual research study that I just learned about, which I thought was quite fascinating. They looked at people with pain, and they looked at dance. And guess what? If you were just moving to your own, didn't do as much of a job. But if you were moving as a group to the music as a whole, something about that community, something about that sense of togetherness and movement and mind and emotion had significantly greater pain control. That's fascinating stuff. And that's why you have the symposium every year. You can log on to the computer, each and every one of you, and get this information one-on-one. There's something about this togetherness in the experience which I believe is so very important. Let me tell you how I learned this. So many, many years ago, I just finished my fellowship, and so I pretty new to the job, and I saw this patient. And she was in her 80s, and she said, well, I've had Parkinson's for 25 years, mild symptoms. And I said, well, I don't believe you. And then we talked. Yeah, you've had Parkinson's for 25 years. So put my pen down, and then that was the day when we used paper and pen. Do you all remember what paper and pen is? And I said, what's your secret? And she told me her secret. Now, this is in the 90s. We didn't do exercise in the 90s for Parkinson's. As a matter of fact, I wrote 2 prescriptions for physical therapy during 2 years fellowship, 2 prescriptions for physical therapy. So what was her secret? She said, I do yoga. So I'm like, oh, okay, I get it. That's your secret. But then she said, no, that's not my secret. This is where the learning experience came in for me. She said, my secret is I teach yoga to people, this is downtown Seattle, with advanced cancer and AIDS. She said, I believe that's my secret. It's not just what I do, but it's the value it brings to me and my community. And I believe her. Hard to prove, but I believe her. But as I've been taking care of Parkinson's disease now for a few decades, you know, I start to hear these stories and these experiences, and that's what I mean by the Parkinson's experience. Now, the Parkinson's experience can go in many ways. I'll tell you another experience, which is the power of the mind and the power of possibility. And this is my other teaching point. A few years later, fast forward, a gentleman with advanced Parkinson's. I was seeing for consult, and I was told he's in a wheelchair. You can't really hear him. And my hand's on the door, and I'm expecting a certain type of interaction with this patient. I'm bringing my own assumptions to my care. I go in the room, and this gentleman, I said to him, so tell me what it's like living with Parkinson's for you right now. And he said to me, and I had to lean really close because I couldn't really hear him well, he said, I'm blessed. I'm blessed. Now, that was not the answer I was expecting from him. I was expecting the list of what I can't do. He said, I'm blessed. And this guy was a captain of industry, CEO. He said, my family's here. They would not have been here 15 years ago. Parkinson's disease gave me the opportunity to reshape what was important in my life, and I'm blessed because I have my family with me today. So this idea of being well is really not just about how well you're moving or what stage of the Parkinson's is. It's really about where your head is and what's important to you, and does it represent possibilities and opportunities. So I will talk about Mount Kilimanjaro right here. Reframe your picture. So this is a photograph of a patient of mine in Seattle, and this is Puget Sound. And I saw this picture. So he, when he first was diagnosed with Parkinson's and tremor, he gave up photography. Many years later, despite progression of his symptoms, he took it back up again. He found a way to do it. Wonderful, wonderful pictures, wonderful portfolio. So he showed me this picture, and I was a little homesick, and I said, oh gosh, I love that sunset. And he said to me, that's not a sunset, that's a sunrise. So I saw something different than what it was. It was a sunrise. And he said to me, "This is not the sunset, but the sunrise. I feel that is what Parkinson's has given me. A chance to look at life anew, focusing on what is important to me. Without PD, I wouldn't be going through life without giving it any additional thought. With PD, I shape how, where my life will go." Nathan has Parkinson's disease and deep brain stimulation. Nathan traveled with us to the top of Kilimanjaro, and we did some video segments going up the way, and I remember asking Nathan, "Did you expect you'd be doing this a couple years ago?" And he said, excuse my language, "Hell no. I didn't expect I'd be doing this before Parkinson's disease." And he did it. And in the training to get to the top of Kilimanjaro, which is a level playing field, whether you have Parkinson's or MS, or I was one of the last, let me put it that way. Everybody was in it together, but he said just that experience of training for the event so improved his walking and his balance. So really testimony to the effort that you put in does pay off. But we want to pay attention to this attitude, this idea of possibilities, this idea of, are there opportunities? Are there positive things in life that we still hold on to despite these changes that Parkinson's may bring? It will influence how you feel in the moment, but also potentially influence how things may change into the future. And there are many ways to do this. But I have at the top, treat depression and anxiety. And that treatment can be through medicines, through counseling, through nature-based therapies, through socialization, so on. But treat depression and anxiety, because it really does cover and color and influence every choice you might make going forth. Now, it turns out this whole mind-body thing is not just voodoos and crystal. It really is accepted in conventional medicine. We just call it something very technical, and that's called the placebo effect. We're all used to the placebo effect as some annoying thing in research trials that we want to control for. And a placebo effect is a non-specific response to a therapy. So it's not, when looking at a medicine, it's not specific to the chemical in the medicine. It's something else that might contribute to a response. Now that response can be positive, that's placebo, negative, that's nocebo. Now there's a lot of work being done on this placebo effect and a lot of work being done on Parkinson's disease and placebo effect. And one of the interests there is one of the neurotransmitters that is part of the placebo effect that mediates this placebo effect is what? Guess. Dopamine. And some of the same areas that are influenced by Parkinson's disease are also influenced by this placebo effect. So what contributes to the placebo effect? And you could say, think of it this way. You're a research trial. If you're taking a treatment, and we know that when you take a treatment, there might be an additional benefit from the placebo effect, wouldn't you want to add that to your life? Yeah. Wouldn't you want to avoid nocebo effect? Yeah. So how might you do it? Well, what contributes to these effects? The first is conditioned learning, and we know that. We know that through Parkinson's research. For instance, your experience with levodopa in the past influences your experience with treatment in the future. Oh, doctor, I don't want that drug. All drugs, they cause dizziness. I don't want that drug. I can't take it. It's not going to help me. That conditioned learning that you're bringing forth, now that can be blocked. That can be altered. The first thing is a sense of awareness that you've had that experience in the past and not to bring it forward, if possible, into and influence and color your new treatment. Same thing, physical therapy, right? It's not just all about medicines. Oh, yeah, doctor, that physical therapy, that's not going to help me. I just know it. Because it didn't help me before, that's why. Well, before is a very different situation. Let's be aware of that. What were your goals? You were expecting it to fix you. Maybe we were going to alter those goals, so you're going to start with a clean slate. The other is expectation or cognitive therapy. And we all know this. Do we expect it to work? If we expect it, there's a greater chance it's going to work. Now that physical therapy is not going to work. It's not going to work. And then one that I think is so very important is meaning. It broadens the scope of placebo effect to add what brings meaning and value. So when we think about integrative medicine, we're really looking at some therapies and personal healing that's really meaningful to you. That's why it's not one size fits all, because what's meaningful to one person may not be meaningful to the other person. But meaning, and we all have different meanings and values that we bring culturally or socially or personally to our therapies. But that's also why places like and foundations like the Michael J. Fox that support research are really interested in the placebo when we look at research studies like stem cell therapy or deep brain stimulation or gene therapy, because these therapies have so much potential value and they mean so much to the people getting them in the research trials, that also can potentially enhance the placebo effect with these trials. That's why even those trials are done with placebo arms, if possible. So think about how you might enhance your placebo effect. I think I have still some more time. And let's talk about stress, because stress really is a big part of the mind and the power of the mind, right? And this is an area where I might say, let's think about how we can look at things differently. So I remember in my training, and everyone would say, yeah, stress makes symptoms worse. Stress makes tremor worse. And stress makes lots of things worse, right? Dyskinesia worse, or maybe freezing of gait worse. How many of you have sat with your doctor? How many doctors have sat with their patients and heard, you know, doctor, when I go on vacation and I sit poolside with my margarita, my tremor's just all over the place and I feel terrible. Right? Right? But they do say, traffic was really bad, I was late, I couldn't park, I'm so sorry, doctor, and my tremor's really bad. So we know that. We know stress influences your symptoms, but what else does that tell us? Your mind, your experience, where your body's physiology is in the moment, influences your symptoms. Let's just look at it, not just glass half full, but glass half empty. Just as you can do things that stress you out and worsen your symptoms, perhaps there are things you can do to help manage your symptoms from this stress management, mind-body control. And we talk about mind-body medicine, there's so many different types, but they all have some, at least from a neurobiological point of view, some similar underpinnings. It's not that stress is bad, per se. It's chronic stress is bad. And over time, we have evolved in a way that we don't have good shut-off valves for stress. We have very good on switches for stress. We don't have good shut-off valves. And like I said, work smarter, not harder. This is an example of we have to work at. And a way to work smarter, we have to work at finding that switch for relaxation, for managing stress. And when you look at some branches of the nervous system, again, oversimplified, but it works. We have the sympathetic nervous system, the fight or flight system, ready to go, ready to take action, ready to deal with stress. Excuse me. We have the parasympathetic. This is that relaxation and recovery, sitting poolside. We're really good. We're really, really, really good at engaging the sympathetic response. Not so good at engaging the relaxation response. And we're actually wired in that direction. It's called negative bias versus positive offset. Why are we wired in that direction? From an evolutionary point of view, we've had to be. What's more important to react fast to? A lion coming at us, or in this day and age, a car charging at us, we have to react to, we have to engage and react fast, or a hammock over there in the sun? Which one's going to keep us alive to react the fastest to, right? We're actually wired in that direction. So we have to work at the relaxation and recovery. And when you look at the physiologic, our body's response to these two branches of nervous system, so for one, in one, maybe our pupils will dilate, right, to get more light in, so that we can actually see. Our heart rate goes up, so we can pump more blood to our muscles. The other one, our heart rate goes down, our blood pressure goes down, we're more relaxed. What are the symptoms that each of these branches modify that we can control. And by controlling them, then we're now using a feedback loop to modify these two systems. So it's a biofeedback loop, if you will. It's our breath, because in one, the sympathetic, our breathing is fast, irregular. And the other one, it's calm and more regular. We can control that. So we can actually influence our neurologic control. The other is our sense of tension, muscle tightness, that sensory sensation. We get in the shoulders, the neck. We can control that. We can do techniques to enhance muscle relaxation. And the other is that thought, that cognitive chatter of anxiety and stress and negativity versus positivity, calmness. So that's what all of these mind-body therapies are utilizing. They're influencing these physiologic responses in some way, in many ways. I also believe there's something to the power of intention. And so when I talk about balance in therapy, I also talk sometimes about passive and active. And they're both important, but maybe using both might be important. So what's an example of passive? Passive therapy might be going to the massage therapy, lying on a table, getting a massage, feels really good, it's very relaxing, and it is. What is active? Active, this might not seem active, but active might be meditation, where you're intentionally training your thoughts and mind in a particular direction. You're intentionally doing the work. I think it's important to balance, not just to choose passive therapies. And I believe that's what this research study with that little chart at the bottom there shows. This was a research study looking at guided imagery. Guided imagery is really, through imagery, placing your mind in a more relaxed, positive, intentional place and enhance the relaxation response in that way. And in this research study, they took people with tremor and they put them through various 15-minute treatments, whether it be nothing at all, whether it be, oh, you just go in the corner and relax any way you usually do, or listen to music therapy, or listen to music, I should say, or this intentional guided imagery technique where you're doing some of that work. And I won't go over the whole thing, but see the bar that's very low, meaning lower tremor? Guess which group that was? Guided imagery. Now, truth be told, this was one session, and the tremor did return, and that's what those other bars were. But the group did say they felt the effect of the therapy influenced their life for at least the next 10, 12 hours. Now, we call mind-body therapies practices. It's practice, just like exercise sometimes is practice to get it right. It's not something that we expect to be able to do at one visit. Now, one of my areas of interest is mindfulness-based therapy, and really a lot of what we're talking about today is incorporated in mindfulness-based therapy. And what is that? You might hear of mindfulness-based stress reduction, mindful therapy, mindful meditation. It's bringing awareness, bringing your attention to the moment without judgment. And why do I like it so much? I like it because it's portable, it's free, it can be done anywhere. That's number one. Free's good, right? I like it too because it helps people deal with distress. So one of the goals of mindfulness therapy is, or I should say a side effect, it's not really a goal, is stress reduction. That's good. Stress reduction is good. But the other is how you respond to your experience in the moment. And I use the term respond instead of react. So let's say you're having tremor. You react. God, this tremor is bad. It's bad. I wish it would go away. My doctor, you just need to treat it. You're reacting to the tremor. You're giving that tremor power, more power, and that negative downward spiral is happening. Responding is differently. Responding is, I'm aware of the tremor. I'm trying not to. We're not going to be perfect. label it, give it that label, negative or positive, see it for what it is, let it go, and live with that tremor, perhaps by enhancing my anti-stress response, it might even get better. Maybe it doesn't get better, but my mind is not reacting in a way that's going to spiral it worse. Now, you can respond to something in the same way you react to it. You can have the same response that you would if you just reacted in that knee-jerk reaction, but one's intentional. One you actually have control of. The other thing I like about mindfulness, which I try to use every day, remember I said positive or negative bias, positive offset? We're wired that way. We see the negative. Look at the news. Look at politics. I'm not going to talk about politics up here. That would be a very dangerous thing for me to do. But we love the negative. We love the negative. We're wired that way. We just latch on to that negative. And we can do that with ourselves. We can do that with our sense of self, our self-esteem, our self-confidence, our symptoms, our future. One good thing about negative bias, positive offsets, we can offset that. So research looking at resiliency, how do people stay strong, maintain resiliency in the face of distress? And it's through positive offset. And whether it is measured mathematically, whether it's measured behaviorally in the laboratory through observational studies, the interesting thing is the fraction is the same. It seems to be that you need 3 positive offsets to every 1 negative. So for today, I want you to have 3 positives to 1 negative, minimum. Then you might say, but I don't have 3 positives in my life. I have Parkinson's disease. It's hard. That's where mindfulness comes in. It is hard. I'm not saying any other way. But that's where mindfulness comes in for all of us. Because it just so happens the genuine positive experiences, you don't have to win the lottery. You don't have to be cured of your disease. Your kids don't have to go to Harvard or Yale or get that big job promotion. It's the little things. And that's where mindfulness comes in, because the little things, we overlook every day. The smile, the gesture, the sunrise, the beautiful experience. So there's a lot of positive offset in our lives, and mindfulness, by seeing the moment, helps us see that. Going back to Kilimanjaro, I remember we had the opportunity to do a safari, and of course everybody wanted to see the big animals, big 7, big 8, I can't remember how many, the rhinos, the lions, and so on. And I was with someone, and they said, look at that little bird. The most beautiful little bird is about this big that they saw. The most beautiful bird, and the person driving the Jeep said, oh, you don't want to see that, it's just a bird. And we stopped. Someone else said, no, let's stop. And we all got pictures, and we looked at this bird and said, oh my gosh, that's something we would have totally overlooked, because all we wanted to see is the big lions and this, that, and the other. We almost missed this wonderful, beautiful opportunity. And then for the rest of the day, guess what we were looking for? Yeah, we saw the lions. They were quite obvious. They were big. They were right there. But that's an example, right, of how it would have been so easy to overlook that. And there's much more diversity and beauty in the birds in these safaris than there is in just the big whatevers. So we have the opportunity to see, feel, and experience the positive at any stage of Parkinson's disease. Now, I don't have a lot of time left, and that's okay. This is something I just will spend a few moments on. If you are looking at healing therapies, complementary therapies, there's not a lot of research there that supports their outcome, because the research is hard to do. But remember, I also talked about the placebo effect. We have to be very careful about what attitudes, values, and meaning we bring to the table, like everything natural is all safe and everything pharmaceutical is not safe. So that's going to color our perception of our therapies and our outcome. But I believe that where complementary medicine plays a role is the belief that we all have the ability to heal chemically, cellularly, physiologically, emotionally, spiritually. And whether it be through antioxidant or anti-inflammation or neuroplasticity, we all have the ability to heal. Now, in Parkinson's disease, it's interesting that most people get their advice about complementary medicine, not from their healthcare provider, but from somebody else, who's tried it. Now, that's not good or bad, but remember, their anecdotal experience is their experience. It doesn't necessarily mean that's the true way this therapy is designed to be used or the true way that it does work. So just keep that in mind and consult your physician. Hopefully, physicians are now more open to. And there's a lot of reason why we should look at biological therapies and diet in Parkinson's disease. We know about the environment and risk of Parkinson's disease with pesticides, for instance. It tells us it's more than just genetics. How we live in our environment might play a big role. But what's the single most question I'm asked by my patients who have an interest in integrative medicine? Doctor, what vitamin or supplement do I take? And they have maybe a long list of vitamins and supplements. And so what's the answer? Oh, good question. Let's talk about your diet. That may not be what they were looking for as the answer, but research does not yet support a particular vitamin and supplement for Parkinson's in the absence, or most conditions, in the absence of a deficiency. Doesn't mean you don't feel better after you take it, but at least at this point, research does not support. But does support, even in Parkinson's disease, multiple foods and dietary profiles that help reduce the risk of Parkinson's disease. So and there's multiple examples, whether it be vitamin B6 in depression, 12 in cognition, vitamin E, vitamin C, calcium, where the vitamin does not equal the food in outcome. And sometimes the vitamin has negative outcome where the food has positive. So when I talk about safety in vitamin supplements, there's the obvious. We want to make sure what you take is pure and is what it says it is on the label. But I talk about extended risk versus benefit. So extended risk versus benefit. Remember I talked about balance. So what's an extended benefit? An extended benefit is, oh, if I take this vitamin or I eat these foods, I'm really feeling good about myself, and I'm going to start paying attention to my health, and I might even throw in some exercise. What's an extended risk? An extended risk is, I take this vitamin, I don't have to eat right. Or even I take this medicine, I take this Lipitor for my cholesterol, I can eat all cholesterol I want, I've got my Lipitor. That's an extended risk. Extended risk is also cost, because many of these therapies are very costly, so pay attention to the cost. Because if it's costing X amount, you're taking it from one bucket to give it to the other. Just be aware of that. Because what if you need it in that bucket for your medicines, for your prescription medicines, for your physical therapy, for your personal trainer, for other things that we know really do make a big difference. Now, when we talk about diet in Parkinson's disease, the diet that seems to reduce the risk of Parkinson's is the prudent diet or Mediterranean diet. What is the Mediterranean diet? Well, in one sentence, it's not the American diet. I think that's probably the best way to define it, right? High in antioxidants, fruits and vegetables, fruits and vegetables, fruits and vegetables. But fruits and vegetables means eating a variety and the color of the rainbow. And somebody raised their hand and said, does that mean Fruit Loops? Right? And it probably doesn't mean that strawberry fruit roll-up thing that is like leather. It's really eating close to the earth. It's food for what food really is intended to be. It's clean eating. It's antioxidant. It's anti-inflammatory. Foods low processed, low in glycemic load, low in sugar, low in saturated fats from animal sources, good fats from fish, nuts, seeds. So it's good old-fashioned common sense. Remember I said we overlook the common all the time? That mindfulness, same thing with our diet. We know it's good for us, but we need reminders. The common's hard to do. The other thing I believe in is I'm very much a fan of fractile math. It's how patterns repeat themselves in nature. Patterns repeat themselves with our bodies and with our health care. So everybody's trying to find this diet for diabetes and this diet for the heart and this diet for cancer, this diet for the brain, this diet for the Parkinson's. This is my guess, and it's just a guess. I don't believe the body works like that. You can't have 10 sets of rules for 10 organ systems and then 100 set of rules for 100 different diseases, right? But when you look at the Mediterranean diet, or what fits that concept of diet, it's Parkinson's, Alzheimer's, stroke, dementia, cancer, heart disease, diabetes, high blood pressure. To me, a diet that shows benefit throughout all of those diseases has something going on. Plus, we're not just Parkinson's. You might have diabetes, you might have high blood pressure, your family member might have diabetes, and you need to eat together. So I kind of look at this where we're not just going to find this is good for one condition and this is good for another condition. And again, every once in a while I'm pointing you to, this is a worksheet that I have. It's in my book, but it's also on my website. I'm trying to go fast. Exercise. I think you're going to hear a little bit more about exercise, but again, let's think balance. Can I have 5 more minutes? Okay. Thank you. Someone I work with is like, get her off the stage. She just keeps talking. Somebody's got to get her. So you can get me off the stage. But I love this stuff, and that's why I can't help myself. Exercise. I mean, we exercise for different reasons. So that's the second most common question I'm asked. What exercise do I do? How do you pin it down to one exercise? We're exercising for our general health. We're exercising for cardiovascular health, for muscle mass, for strength, for agility, for coordination, for weight control. We want to perform better. We want better stamina. We want to exercise anti-Parkinson's wise. We want to reduce the small movements with big movements. We want to exaggerate our movements and keep our grace and agility. We want to enhance this idea of neuroprotection. How do we protect our vulnerable dopamine nerve cells and neuroplasticity? How do we actually change our entire brain due to our exercise? So this is where it won't be one size fits all, even though you do kind of hear that in the media, because the media latches on to this one exercise paradigm because that's what research showed, and it's correct. But that doesn't mean it's going to be the be-all and end-all for you, and especially if you're not doing it and you're not liking it and you're not adding quality and you're not doing it well, you may not get their results. And there's lots of different exercise and randomized controlled studies that have been shown to be helpful in Parkinson's disease. Let me show you this one, because it goes back to quality. I am just a believer in quality. It goes back to the idea of experience. And so when this research came out, people, well, what does it mean? How do I interpret this? I know I have to exercise high intensity, high heart rate. And they put people with Parkinson's on a treadmill and separated them into 3 groups. This one's high intensity, high heart rate, moderate intensity, weight training and resistance training. And then they measured particular things, and of course fitness and strength. And which group had the best outcomes as far as walking, gait and walking? I'll give you a clue, the treadmill group, because it's specific to what they wanted to do, walk better. But it wasn't the high intensity group. Now, it's a hypothesis, and this is the author's hypothesis. Why? Because in the high intensity group, you get kind of sloppy. It's all about going fast, but it's not good quality arm stride, arm swing, leg stride. I'm getting it. Heel strike. See, it's hard even for me. It wasn't good quality, so the quality of the experience is really very important. Let me go back to 2 research trials, and I promise I'm almost done. Our friends, the little lab rats, because it's hard to do these measures in people. So they did a study of lab rats, and they exposed them to various things. This group just did whatever they usually do in the cage. This group were forced on a wheel, had to go, that forced exercise. This group had a jungle gym. They had balls, colorful balls, and things to climb up and down, and they have all these great little creative colorful things. And then they looked at an area of the brain in the back, the cerebellum here, that helps control coordination and movement and motor learning. Despite the fact that the group on that wheel did 18 times the amount of work, which one had the more robust nerve cell connections? The jungle gym. So there is something to the quality and the experience. For some of you, it might be okay to have the treadmill in the basement. For some of you, it might be a walk in the park. One other thing, and it brings back to the mind-body connection. And this research, they looked at how exercise in rodents protects that rodent from chemically induced Parkinson's. So we have a neurotoxin, we can cause Parkinson's. Exercise reduces that effect, and sometimes even looks like it's almost protecting and totally protecting that effect. So if you exercise, it's protective. But so they took these little lab rats and they forced the exercise and they gave them this neurotoxin and they showed less dopamine nerve cell loss and less motor changes in these rats. But then they stressed the rats and did the same thing. And how do you stress a rat? Let's change your sleep-wake cycle. Night is day, day is night. Let's change your food up. And let's separate you from your litter mates because you're social beings. And then they did the same experience. Guess what happened? No benefit. Again, what I'm presenting to you is that balance and that inclusion of quality and value, and community is an important part of your integrative therapy. I know you're not lab rats, but it's the best I can do. So, comments, questions, tips. I do have that tip sheet on my website, and I just wanted to mention a lot of this information is in a book I just wrote, and I do have flyers if you're interested, in 2 books to give to Pat or Chris. You could raffle them off, you could keep them in your library, do what you like with them. But I'm really excited about that book that was just published this year. So, you know, I hope you don't leave saying, well, she hasn't told me anything I don't know already. But maybe you might leave, yeah, she's told me everything I know, but it's really important stuff. And it's going to set the stage for, as you hear about medicines and new medicines and research and therapy and music and rehab and dance and yoga, how you're going to approach it. Can't do it all. And that's not the intention either. Can't do it all, but add it to your life and that positive balance, which I believe will help you move forward and really change your trajectory. Thank you.